Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, thank you so much for joining us.
Well, thank you for having me once more on your program.
Yes, sir. Let's address vaccines. Now, we've read that Brazil will be seeking approval for the Oxford University AstraZeneca, and we wanted to know, this basically is reasonable indication that more vaccines will get past the trial stages. So we wanted to know how that impacts Ghana, and specifically that Pfizer is not on the COVAX. What does this mean for us?
Well, it's
a
a number of things here.
Yes.
So, Pfizer's vaccine has been given emergency use authorization in a number of countries, including the United States, Canada, the UK, and Europe. So they're going ahead in using the Pfizer's vaccine in those countries. The Moderna vaccine has also been given emergency use authorization, and that's being used in the US. Now, both of these vaccines were designed with novel technology. That's mRNA technology, and they've been able to do that very quickly, and now they're using it in the general population. So, because of the way that it was designed, and because of the countries that funded the vaccine development, those countries have kind of pre-order, and therefore the first set of vaccines would go to them. And that's why they're being used in those countries. COVAX, which is a mechanism set up by the World Health Organization, CEPI, and Gavi, they have come together and created this facility so that they can have broader purchasing power. They'll be able to buy bigger volumes of vaccines. And what they've started to do is to work with a number of researchers, work with a number of the manufacturers to get a portfolio of vaccines. So they have like a basket of different types of vaccines. They have listed as part of that portfolio Moderna vaccine, which meant that they probably would have concluded some form of an agreement with Moderna. We don't know the details as yet. They have similar agreements with AstraZeneca and so forth. So COVAX is one mechanism where they can buy in bulk for various countries. Membership into COVAX is of two types. There are countries who would be paying for their vaccines, and there are countries that would be getting their vaccines free. We fall into the category where we will be getting the vaccines through COVAX for free, right? And there's members who are paying. In addition to COVAX, other countries might have entered into bilateral arrangements directly with the manufacturers. So in the case of maybe Brazil, they probably have a direct agreement with the manufacturers, and many other countries have done similar arrangements. So that's probably why they want to move ahead in terms of the AstraZeneca Oxford University vaccine. That vaccine, when the stage 3 readouts were done, maybe about a month ago, it found that if you give a full dose, these vaccines are a 2-dose vaccine. So when the first dose, if you give a full dose, and then with the second dose, a full dose, then the efficacy of the vaccines were judged to be at 62%. They had a subset of people where they had given half a dose as the first dose, and then a full dose on the second time. And in that subgroup of patients, what you had was an efficacy that was at 90%. So what they did was to do an average, and that's why they're saying these vaccines are about 70% or so efficacious, right? So it's something that they're still investigating, and they had promised to release some additional information. And I guess based on that information, countries would start making decisions. Brazil probably have gone through each country. They have their own regulatory arrangements. And Brazil probably would have granted, as you're asking, every country can decide to grant for any product, any vaccine, emergency use authorization once they believe that it meets the safety profile. So whether Brazil has done so, I haven't seen in the literature that they have actually granted that. But AstraZeneca vaccine, when they were doing the stage 3 trials, one arm of the trial was in Brazil. So some persons in Brazil would have already been exposed to the vaccine anyhow.
Thank you for deciphering my very long mixed up question. All right, just two things from that. So Moderna is on the COVAX, and just so that we're clear, we are not behind time because the actual rollout plan for the vaccine is next year, and we have discussed that before.
Yeah, well, we have started working on rolling out the vaccine. So we have started preparations here in Guyana. We have looked at our cold storage facility. We are giving out some contracts to expand the capacity. Depending on which one of the vaccines you'll be using, then the requirements of cold storage differs. So if it's a Pfizer vaccine, you require at least -70. If it's a Moderna vaccine, -20. Most of the other vaccines might require between 2 to 8 degrees Celsius. So there's a range of temperature that you have to cater for. And we have started planning in that direction. And by early next year, our cold storage facilities would be ready. We have also made some orders for different types of freezers. We already have freezers that deal with 2 to 8 degrees Celsius. We have some -20 freezers, but they're being used more in our laboratories. So for the purposes of vaccines, we'll have to bring in new -20 freezers. And of course, the -70, we don't have those, so we're working on getting those into Guyana.
Okay. As we're speaking about vaccines, let's discuss the immunization. Well, the bill that is to come. Last week in Parliament, you brought a motion and it was passed, and you indicated that one of the things that we really need, of course, is our legislation needs to be updated because we don't have those for adults, rather for children. Most people are of the opinion that it might be something that is forced upon them, but like you indicated in the Parliament, this is not the case, and you've your own self said it should be a choice, but persons must be educated. Could you tell us a little bit of what it takes before the bill is actually presented?
Well, we have done a draft piece of legislation, and as you said, in the legislative framework in Guyana, there's a gap as it relates to immunization. Our current legislation only provides for immunization of children. It does not allow for the immunization of adults. Now, there are two things we can do. One, we can either amend the existing legislation that deals with immunization of children, or we can draft a new piece of legislation that speaks to immunization of adults. We opted to do the latter, which means that we've drafted a special piece of legislation that deals with immunization of adults. And that's what I spoke about. Early in the new year, we want to bring that bill to Parliament. I suspect once it's laid, as is normal with other bills, you would have a minimum of 7 days for everyone in the Parliament to peruse the bill, to familiarize themselves with the content of the bill. And then we go into discussion on the bill. So that would be the second reading, and then you do third reading. So there can be a ventilation of ideas in the Parliament, and people might have different opinions as to what they would like to see in the bill, and those things would come out on the floor in the discussions and in the debates that would follow. And then we try to take that and move the process forward. So the bill really, I think, it's really trying to provide for or fixing that gap that we have in our legislation. And so I don't anticipate too many challenges with it, but you never know.
Sure. So just related to this, but a little bit maybe to the side, but important. Persons would believe that they don't have a say. And you've been a parliamentarian for a very long time. And I believe when for a person, a man in the street, he has an issue with a particular bill, who does he go to?
Well, in the development, these bills, first of all, are not developed in a vacuum. They're developed out of real problems, real things that people see can become problems, and they're designed to fix those. So in its first instance, it's rooted in a particular context. In this context, we know that the only way that you can exit this pandemic is if people are immunized. And the only way you can get immunity is, well, one way that you can get immunity is through a vaccine. Now, if the legislative framework in the country does not provide for adults to get vaccines, then I think we have a challenge here. And that is why we want to make sure that we have that legislative framework. COVID-19 is different in the sense that older people are the ones that we need to vaccinate, right? Traditionally, when we use vaccines to prevent diseases in various countries, we talk more about childhood diseases. In this case, we are looking at a vaccine that is more for older people or adults. And that then shows the gap that we have in our legislation, right? Coming back to the question of how people can get involved, at the developmental stage of these bills, there are usually consultations with different stakeholders and so forth. And people are allowed their inputs. And even if they have any, I would say, if that process has passed, they have another opportunity through their representatives in Parliament to let the representatives know so that they can raise those ideas in the Parliament. So that's another opportunity.
And you have indicated that the private sector will be involved as well.
I guess there are a number of people who having an understanding of the problem, have supported what we are doing. And this is not unique to Guyana. This is a thing that is happening globally. So a lot of countries are doing the same thing. And so you would see a massive change in legislation for countries that only had immunization legislation for children. Around the region, around the Caribbean, this is also going to happen. So we might be first out of the block because we've been so proactive. But I guess other countries in the region would also be following the same pattern.
Okay. I know you were pressed for time today, but I wanted to speak a little bit on the variant. We have spoken about this. Any update from CARFA in terms of tracking it?
Well, CARFA, as I said before, they had a meeting with all the chief medical officers of the region and had an initial discussion. Those meetings would be followed up this week. As an update, they had said to us at that meeting, while providing information, that they have to get more details before they can start making some decisions. So we haven't received any new updates, but I'm sure that before the end of the year, they probably would have a second meeting where we'll get those updates. In the meantime, we continue to monitor what's going on with that particular strain of the virus. We know from information released by the UK that it's more transmittable. In some cases, they're attributing the increase in transmission as much as about 70% faster. So that's something that we have to look at. And of course, more scientific studies would be done to see how this strain might affect the dynamics of the disease, because there are about 17 or so mutations that they have observed, and therefore this is something that you'll want to constantly track. They were able to pick this up in the UK because for every, for the patients that are being diagnosed, at least 10%, they'll take samples from them and do genetic analysis. And based on that, they can see the different patterns. And that's how they were able to detect that you had a new strain that was circulating in the UK. So it's good that we are able to do this type of scientific analysis. And then, of course, they have found similar strains in other countries. So it's a work in progress, but the scientific community is tracking this.
All right, thank you, Minister. One final question before we go. A colleague of mine was wondering about our reinfection rate of COVID-19. We haven't spoken about that in a little while.
Yeah, reinfection is possible, and what they have said in the scientific literature is that if you were infected with one strain, you can get reinfected with another. So that is possible, and there have been rigidly documented cases of reinfection. We have not been able to rigidly document such cases in Guyana because it requires very detailed scientific analysis in the first instance, and then to check again with the reinfection. We know, however, that there are persons who were tested positive before, and after a couple of months they were well, and then they got all the typical signs of COVID, and when they retested, they were again positive. So we have some cases of that, but the scientific rigor in terms of checking all the different parameters and so forth, I don't think that was done. So these, our cases at least that we have identified, we have not really published them or done anything with them. But within the medical community here, they have identified a few cases like that.
Okay, Minister, thank you so much for joining us today.
No problem.
Well, that's it for today's COVID-19 update. We, of course, just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.